Bernalillo County Commissioners recently voted to approve a tax increase to support mental health services. Voters approved the idea last year, and the vote in the county commission was along party lines, with some commissioners arguing that a plan for how to use the funds isn't fully formed yet. And Sophie, that was an interesting side. We'll get to that in a second, about approving something without having a plan. But the bigger issue here is, it just seems to me we've got a body here stepping forward and saying, look, you know, the taxpayers need something more here. We are the taxpayers' advocates, and we need to figure this out and spend some money. How did you see this?
I actually find that very heartening that the county is willing to do that. I mean, we've had a 5-year conversation here about, and longer really, about mental health issues. Quite a bit of back and forth. It is time for movement. One of the things that I also find quite heartening is the idea that there will be a governing body.
Yes.
You know, so plans are quite loose, but the idea that this governing body for these funds would include the city of Albuquerque, would include local hospitals, would allow for coordination between the county and the city. And let's face it, someone who needs services and is in the city versus in the county, it needs to be pretty seamless.
That's right.
Because they can't be expected to figure out where am I today and therefore which set of services do I get.
Interesting. Senator, the city and the county need to use their money efficiently. You know, Ike Benton's quoted that we spend about $15 million here in the city on these types of services. Right. Who knows what a percentage of that is, so what Sophie's talking about, leakage, so to speak. It's not being used as well as it could. Again, is this the opportunity here? Is something, as the county tipped over something here, that all folks can come together and figure this out at some level?
Well, I hope so. And I mean, there's really 3 pieces to this. One is the tax increase, which could have been a 16th, could have been an 8th. It turned out being 3/16. So they could have dialed that back a little bit. And I think it's too much. A lot of people feel it's a regressive tax. The other thing is
it too much as a percentage? What's too much for you? Well, just the simple fact of having a tax to pay for this, or?
Well, just the tax increase could have been less.
Okay.
It could have been less. Yeah, because a part of it's going to mental health. A part of it is to recover the hold harmless, the money the state's been giving to the county to make up for some of the tax on medicine, some of the taxes on food. But you know, the elephant in the room here, I think, is the fact that we don't have a plan. So. You know, we live in a culture where we're spending, you know, we're creating disorders, and we have an increased reliance on prescription drugs. You know, we have severe mental illness in my family, bipolar problems. I understand the value of treatment. I understand the value of prescription medicine and that healing process. But you know, if you look at, you know, you look at conduct disorders, you look at authority disorders, you look at stress and anxiety disorders, you look at the fact that 1 out of every 6 kids under 20 is on prescription medication, and we don't have a plan. How are we going to heal those people? Does this plan include that? We're basically doubling the infrastructure without a plan, and that's the biggest problem I have with the action the county commission took.
Interesting. It's something to consider there as listening to you talk. And Rob, you know, $30 million, it could have been $40 million, as the Senator pointed out. They reduced the amount of tax. But we don't know what the number is to fix something. Do you know what I mean? We don't know what the magic number is. Are you uncomfortable with the way this is going so far?
My greatest degree of discomfort came from the fact that we've got $30 million, $20 million we're going to give to the mental health, question, and there is no question. You know, even from a fiscal conservative, we've got some mental health issues in Albuquerque we need to take care of. My discomfort comes from the $10 million because we're apparently Bernalillo County is $800,000 over budget. So we're going to get so we've got $10 million for an $800,000 situation. Now Art Delacruz came back and said, well, you know, if we don't have a plan in mind, to take care of this hold harmless thing, then we can always rescind it. Well, when was the last time the government rescinded? Oh, we weren't over that $900,000. We don't need anymore. We're giving. You got to
maybe chuck a little bit.
$9 million, I should say. So that's what.
Lonnie Talbot had an issue with that as well. He was one of the county commissioners that voted no on this as well, Laura. And it's interesting. Pick up on Rob's point and add in also, we don't know what the number is going to be to help turn this around. But at the same time, peeling off a bit of it just because you're under budget seems just sort of. You know what I mean? It's not a clean amount of money just directed at one thing. You know what I mean? It's just.
It's
Interesting.
not, but it's no different than what every county commission in the state is able to do. I mean, in this case, I think what makes this unique is that they did have a referendum of sorts. They had a public opinion poll that went out in the last election that was overwhelmingly supported in terms of a 1/8, which would have been 4/16 of a tax increase. They dialed it back to 3/16, which I think that they should be commended for the leadership that they're taking in addressing this problem soon. I think there is an issue with plan, but if you look at the timing of when this will actually be collected, I mean, we're talking about it going into effect July 1st. It actually will be collected between July 1st and the end of the year. They're supposed to have a report back ideally by December, but possibly sooner is what they've said, to try to get something in place. So they're right now working with a consultant to try to figure out how to actually use that. So that's when it will be collected by Tax and Rev. By the time it actually gets back to the county, that's the following year. So the timing, I understand the concern with not having a clear plan, but I think that it's a very strong effort on the part of the county commission, the three leaders that put forth this proposal to address a really big problem that we've had for years now in this county.
How would you like, in your perfect world, how would you like to see this? What would be the first thing you would go after? Is it infrastructure, facilities, beds, outreach? What would be your goal with 20 million to work
I think
with?
that's just it. We need to have a comprehensive plan. I think there's no one area that I would sort of put all my eggs into. I think it's important to have a multifaceted approach, and you have to have the right expertise on that committee. It's good that they're going to have a task force or committee of sorts to look at this, but you have to make sure that you have not just county and city officials, but also mental health providers, advocates, people who work with folks that are really vulnerable in this area, and make sure you're addressing all of those different facets that will make a difference.
Would that make you more comfortable, Senator? I hear your point about the approach, and Laura, nobody knows really where to start, what to do, because the problems are so deep and wide. What would be your approach if a plan would come to the surface? What would you like to see in it?
Well, it's a good question. I mean, keep in mind, too, we're basically doubling the infrastructure, the funding of the infrastructure for mental health, behavioral health. So that's a big jump.
Right.
It's not incremental. It's a doubling of it. But I think we need to look at models of health. I think that needs to be a starting point. I mean, you look at a lot of these conduct disorders and anxiety and stress disorders and authority aversion disorders. I mean, my goodness.
That's for real.
Yeah. I
Why
mean,
did you point at me?
We're all guilty a little bit. That's right.
The question is, how are we going to be able to resolve these problems? And I think we need to look at models of health. We need to look at what's happening in the family. I mean, you look at a lot of these disorders and, non-parenting, under-parenting, dysfunctional families, that kind of thing. Health, nutrition. Exercise, that kind of thing. Spirituality, a part of the healing process. I remember when I was in the Senate visiting a lady who had a complaint about the healthcare system. She was obese, she was eating candy bars, she was on oxygen, and she was complaining about the healthcare system. Well, what's the responsibility of the patient in terms of the whole healing process? And I think a lot of times that question isn't answered as sufficiently as it should be answered. So comprehensive, holistic, look at models of health and incorporate that into our plan.
It's interesting, we're having this discussion as we tape this, where the city has yet again had another hiccup with the tent city, and it's not opening now, the new location. We've just got to get our arms around this. Of course, that's not a county thing, but we've just got to find a way to get holistic about this. We'll end it there. Up next, should the Albuquerque Police Department stop using an elite training facility at Kirtland Air Force Base?